Question 1. A client with suspected peptic ulcer disease reports burning epigastric pain that improves after eating. Which condition is most likely? A. Gastric ulcer. B. Duodenal ulcer. C. Gastroenteritis. D. Pancreatitis. Correct answer, B. Duodenal ulcer. Rationale. Pain from a duodenal ulcer typically improves with food intake, while gastric ulcer pain worsens with eating. This is a classic Nclex trap. Strategy. Focus on pain timing with meals. Better with food duodenal ulcer. Worse with food gastric ulcer. Question 2. A nurse is caring for a client with acute pancreatitis. Which finding requires immediate intervention? A. Serum amylase 300U/L. B. Gray-Turner's sign. C. Nausea and vomiting. D. Abdominal pain rated 6 out of 10. Correct answer, B. Gray-Turner's sign. Rationale. Gray-Turner's sign, flank bruising, indicates retroperitoneal bleeding, a life-threatening complication of pancreatitis. Strategy. Always prioritize signs of internal bleeding or shock over expected symptoms like pain or nausea. Question 3. A client with liver cirrhosis is prescribed lactulose. What is the primary purpose of this medication? A. Reduce fluid retention. B. Lower ammonia levels. C. Prevent infection. D. Improve appetite. Correct answer, B. Lower ammonia levels. Rationale. Lactulose helps remove ammonia through stool, preventing hepatic encephalopathy. Strategy. Link medications to life-threatening complications, not just general symptoms. Question 4. A client with Crohn's disease is at highest risk for which complication? A. Continuous lesions in colon. B. Fistula formation. C. Bloody diarrhea. D. Mucus in stool. Correct answer, B. Fistula formation. Rationale. Crohn's disease causes skip lesions and transmural inflammation, leading to fistulas. Strategy. Differentiate. Crohn's fistulas, skip lesions. Ulcerative colitis, continuous lesions, bloody diarrhea. Question 5. A nurse is assessing a client after cholecystectomy. Which finding should be reported immediately? A. Mild abdominal pain. B. Small amount of serous drainage. C. Clay-colored stool. D. Nausea after eating. Correct answer, C. Clay-colored stool. Rationale. Clay-colored stool indicates lack of bile flow, suggesting possible bile duct obstruction. Strategy. Watch for color changes in stool/urine, they often signal serious biliary issues. Question 6. A client with ulcerative colitis reports frequent diarrhea. Which electrolyte imbalance is most likely? A. Hyperkalemia. B. Hypokalemia. C. Hypercalcemia. D. Hyponatremia. Correct answer, B. Hypokalemia. Rationale. Frequent diarrhea leads to loss of potassium, causing hypokalemia. Strategy. Diarrhea equals think low potassium immediately. Question 7. A nurse is caring for a client with GERD. Which instruction is most appropriate? A. Lie down after meals. B. Eat large meals. C. Elevate the head of the bed. D. Drink fluids with meals. Correct answer, C. Elevate the head of the bed. Rationale. Elevating the head reduces reflux by preventing stomach acid from flowing back into the esophagus. Strategy. GERD equals gravity is your friend, keep head elevated. Question 8. A client with acute hepatitis is experiencing fatigue. Which diet is best? A. High-fat diet. B. High-protein, high-calorie diet. C. Low-carb diet. D. NPO. Correct answer, B. High-protein, high-calorie diet. Rationale. This supports liver regeneration and energy needs. Strategy. Liver disease, non-encephalopathy, equals fuel the body. Question 9. A client has a nasogastric tube. Which action confirms placement? A. Inject air and listen. B. X-ray verification. C. Observe for bubbles. D. Ask patient. Correct answer, B. X-ray verification. Rationale. X-ray is the gold standard for NG tube placement. Strategy. When safety is critical, choose the most accurate method. Question 10. A client with appendicitis suddenly reports relief of pain. What does this indicate? A. Healing. B. Perforation. C. Dehydration. D. Infection resolving. Correct answer, B. Perforation. Rationale. Sudden pain relief may mean the appendix has ruptured, this is dangerous. Strategy. Sudden improvement in acute abdomen equals worsening condition. Question 11. A client with esophageal varices is at risk for A. Constipation. B. Massive bleeding. C. Dehydration. D. Infection. Correct answer, B. Massive bleeding. Rationale. Varices are fragile veins that can rupture and cause life-threatening hemorrhage. Strategy. Varices equals think bleeding emergency. Question 12. A nurse is teaching about colonoscopy prep. Which statement is correct? A. Eat high-fiber foods before test. B. Drink bowel cleansing solution. C. Avoid fluids. D. Take iron supplements. Correct answer, B. Drink bowel cleansing solution. Rationale. A clean colon is required for accurate visualization. Strategy. Scopes equals empty the organ first. Question 13. A client with pancreatitis should avoid A. Protein. B. Carbohydrates. C. Alcohol. D. Fluids. Correct answer, C. Alcohol. Rationale. Alcohol is a major trigger for pancreatitis. Strategy. Pancreatitis equals no alcohol, no fat. Question 14. A client has ascites due to cirrhosis. Which diet is appropriate? A. High sodium. B. Low sodium. C. High fat. D. High sugar. Correct answer, B. Low sodium. Rationale. Sodium restriction reduces fluid retention. Strategy. Fluid overload equals cut sodium. Question 15. A client with bowel obstruction presents with A. Diarrhea. B. Constipation. C. Hyperactive bowel sounds. D. Flat abdomen. Correct answer, C. Hyperactive bowel sounds. Rationale. Early obstruction causes increased bowel activity. Strategy. Obstruction early equals loud sounds, late equals silent. Question 16. A client with peritonitis is placed in which position? A. Supine. B. High Fowler's. C. Prone. D. Trendelenburg. Correct answer, B. High Fowler's. Rationale. This reduces pressure on the abdomen and improves breathing. Strategy. Abdominal inflammation equals sit them up. Question 17. A client with GERD should avoid A. Lean meat. B. Chocolate. C. Vegetables. D. Rice. Correct answer, B. Chocolate. Rationale. Chocolate relaxes the lower esophageal sphincter, worsening reflux. Strategy. GERD triggers equals chocolate, caffeine, spicy foods. Question 18. A client with dumping syndrome should A. Drink fluids with meals. B. Eat small frequent meals. C. Eat high sugar foods. D. Lie flat after eating. Correct answer, B. Eat small frequent meals. Rationale. This helps prevent rapid gastric emptying. Strategy. Dumping syndrome equals slow digestion down. Question 19. A client with hepatitis B transmission occurs via A. Air. B. Blood. C. Water. D. Food. Correct answer, B. Blood. Rationale. Hepatitis B spreads through blood and body fluids. Strategy. Hep B equals body fluids transmission. Question 20. A client with lactose intolerance should avoid A. Bread. B. Milk. C. Rice. D. Chicken. Correct answer, B. Milk. Rationale. Lactose is found in dairy products. Strategy. Lactose equals milk sugar. Question 21. A client with peptic ulcer is at risk for A. Bleeding. B. Fractures. C. Stroke. D. Asthma. Correct answer, A. Bleeding. Rationale. Ulcers can erode blood vessels. Strategy. Ulcer equals bleeding risk. Question 22. A client with cirrhosis develops confusion. What is the cause? A. Hypoglycemia. B. Ammonia buildup. C. Infection. D. Dehydration. Correct answer, B. Ammonia buildup. Rationale. Leads to hepatic encephalopathy. Strategy. Confusion plus liver equals ammonia problem. Question 23. A client after gastrectomy needs which vitamin? A. Vitamin C. B. Vitamin B12. C. Vitamin D. D. Vitamin K. Correct answer, B. Vitamin B12. Rationale. Loss of intrinsic factor affects B12 absorption. Strategy. Stomach removal equals B12 issue. Question 24. A client with diarrhea is at risk for A. Fluid overload. B. Dehydration. C. Hypertension. D. Obesity. Correct answer, B. Dehydration. Rationale. Excess fluid loss leads to dehydration. Strategy. Diarrhea equals fluid loss. Question 25. A client with constipation should increase A. Fat. B. Fiber. C. Protein. D. Sugar. Correct answer, B. Fiber. Rationale. Fiber promotes bowel movement. Strategy. Constipation equals add fiber plus fluids. Question 26. A client with acute pancreatitis reports severe pain. Where is it located? A. Lower abdomen. B. Right lower quadrant. C. Epigastric radiating to back. D. Left lower quadrant. Correct answer, C. Epigastric radiating to back. Rationale. Classic pancreatitis pain pattern. Strategy. Pancreas pain equals goes to the back. Question 27. A client with hepatitis A transmission is through A. Blood. B. Fecal-oral route. C. Airborne. D. Skin contact. Correct answer, B. Fecal-oral route. Rationale. Often spread through contaminated food or water. Strategy. Hep A equals poor hygiene/food contamination. Question 28. A client with bowel perforation may show A. Bradycardia. B. Rigid abdomen. C. Clear lungs. D. Increased appetite. Correct answer, B. Rigid abdomen. Rationale. Peritonitis causes a board-like abdomen. Strategy. Rigid abdomen equals surgical emergency. Question 29. A client with GERD should avoid eating A. Early morning. B. Before bedtime. C. At noon. D. In the afternoon. Correct answer, B. Before bedtime. Rationale. Lying down after eating worsens reflux. Strategy. No food 2 to 3 hours before sleep. Question 30. A client with ileostomy output is expected to be A. Solid. B. Formed. C. Liquid. D. Bloody. Correct answer, C. Liquid. Rationale. Ileostomy bypasses colon, so no water reabsorption. Strategy. No colon equals liquid stool. Question 31. A client with liver cirrhosis has pruritus. What is the cause? A. Infection. B. Bile salt accumulation. C. Dehydration. D. Low protein. Correct answer, B. Bile salt accumulation. Rationale. Bile salts deposit in the skin, causing intense itching. Strategy. Liver problems plus itching equals bile issue. Question 32. A client with pancreatitis has low calcium levels. Why? A. Kidney failure. B. Fat necrosis binds calcium. C. Excess insulin. D. Dehydration. Correct answer, B. Fat necrosis binds calcium. Rationale. Calcium binds to fatty acids in pancreatitis, leading to hypocalcemia. Strategy. Pancreatitis equals watch calcium drop. Question 33. A client with Crohn's disease should avoid A. Low-fiber foods. B. High-protein foods. C. High-fiber foods. D. Fluids. Correct answer, C. High-fiber foods. Rationale. Fiber can irritate inflamed bowel during flare-ups. Strategy. IBD flare equals low residue diet. Question 34. A client with ulcerative colitis stool is typically A. Hard. B. Bloody. C. Black. D. Oily. Correct answer, B. Bloody. Rationale. UC causes continuous inflammation and bleeding in colon. Strategy. UC equals bloody diarrhea. Question 35. A client with NG tube suction is at risk for A. Hyperkalemia. B. Metabolic alkalosis. C. Metabolic acidosis. D. Hypernatremia. Correct answer, B. Metabolic alkalosis. Rationale. Loss of gastric acid leads to alkalosis. Strategy. Vomiting/NG suction equals lose acid alkalosis. Question 36. A client with hepatic encephalopathy should avoid A. Carbohydrates. B. Protein. C. Fluids. D. Vitamins. Correct answer, B. Protein. Rationale. Protein increases ammonia levels. Strategy. Confused liver patient equals limit protein. Question 37. A client with appendicitis should avoid A. Pain meds. B. Heat application. C. For fluids. D. Antibiotics. Correct answer, B. Heat application. Rationale. Heat can cause rupture of the appendix. Strategy. Appendicitis equals no heat, risk of rupture. Question 38. A client with cirrhosis develops ascites. Which medication is expected? A. Insulin. B. Diuretics. C. Antibiotics. D. Analgesics. Correct answer, B. Diuretics. Rationale. Diuretics help remove excess fluid. Strategy. Fluid overload equals give diuretics. Question 39. A client with pancreatitis is NPO. Why? A. Prevent vomiting. B. Rest the pancreas. C. Reduce fever. D. Improve appetite. Correct answer, B. Rest the pancreas. Rationale. Eating stimulates pancreatic enzyme secretion. Strategy. Pancreatitis equals no stimulation NPO. Question 40. A client with peritonitis shows which vital sign change? A. Bradycardia. B. Hypotension. C. Hypertension. D. Slow respirations. Correct answer, B. Hypotension. Rationale. Fluid shifts can lead to shock. Strategy. Infection plus abdomen equals shock risk. Question 41. A client with esophageal varices should avoid A. Soft foods. B. Straining. C. Cold drinks. D. Small meals. Correct answer, B. Straining. Rationale. Straining increases pressure and can cause rupture. Strategy. Varices equals avoid pressure. Question 42. A client with GERD medication includes A. Antacids. B. Antibiotics. C. Diuretics. D. Insulin. Correct answer, A. Antacids. Rationale. They neutralize stomach acid. Strategy. GERD equals reduce acid. Question 43. A client with cirrhosis has edema. What causes this? A. High albumin. B. Low albumin. C. High sodium. D. Low glucose. Correct answer, B. Low albumin. Rationale. Albumin maintains oncotic pressure, low levels cause fluid leakage. Strategy. Edema plus liver equals low albumin. Question 44. A client with bowel obstruction late sign is A. Hyperactive sounds. B. Absent bowel sounds. C. Diarrhea. D. Increased appetite. Correct answer, B. Absent bowel sounds. Rationale. Late obstruction leads to decreased activity. Strategy. Late obstruction equals silent abdomen. Question 45. A client with hepatitis should rest because A. Prevent infection. B. Reduce liver workload. C. Improve appetite. D. Increase metabolism. Correct answer, B. Reduce liver workload. Rationale. Rest conserves energy for liver healing. Strategy. Hepatitis equals rest the liver. Question 46. A client with ileus presents with A. Diarrhea. B. No bowel movement. C. Bloody stool. D. Increased appetite. Correct answer, B. No bowel movement. Rationale. Ileus equals lack of intestinal movement. Strategy. Ileus equals paralysis of bowel. Question 47. A client with GI bleeding shows A. Bright red stool. B. Coffee ground emesis. C. Clear vomit. D. Yellow stool. Correct answer, B. Coffee ground emesis. Rationale. Indicates upper GI bleeding. Strategy. Coffee ground equals digested blood. Question 48. A client with dumping syndrome should avoid A. Protein. B. Fluids between meals. C. Sugary foods. D. Small meals. Correct answer, C. Sugary foods. Rationale. Sugar increases rapid gastric emptying. Strategy. Dumping syndrome equals avoid sugar. Question 49. A client with cirrhosis has spider angiomas. This indicates A. Infection. B. Hormonal imbalance. C. Dehydration. D. Bleeding. Correct answer, B. Hormonal imbalance. Rationale. Liver failure affects estrogen metabolism. Strategy. Skin changes plus liver equals hormone issue. Question 50. A client with acute abdomen should first receive A. Oral fluids. B. Pain medication. C. NPO status. D. Laxatives. Correct answer, C. NPO status. Rationale. Prevents complications if surgery is needed. Strategy. Acute abdomen equals prepare for surgery keep NPO.